Welcome back. Well, as I mentioned, we have Jeff Parker here today. Hi, nice to see you.
Good morning. How are you, Lisa?
Good, good. Well, it's Friday, as I had talked about, and it's a 3-day weekend, so definitely going to be some people getting together, so we'll talk a little bit about social distancing later, but why don't you start off and giving us an update of what's going on around us?
All right. Well, with regards to some of the COVID-19 numbers, we're at 4,841 for the county, total cumulative numbers for people that have tested positive. In the last day, 115, so it actually went down. It was in the 200s and down to 115, which is a good sign because our testing in Orange County has gone up. And now they're averaging over 1,300 tests a day. So the fact that 115 is our number of positive tests, that's a very small percentage of those being tested, which is a good thing. On the negative side, the last 2 days have seen the largest increase in deaths, unfortunately, in Orange County, primarily due to the fact that they had an outbreak at some of the nursing homes. And so a high number of the cases that I'm referring to there in the 2 days of deaths have referred to the nursing home incidents that they've had. But the importance to that is, again, our community is a high-risk community. So when you get into a nursing home or assisted living and it gets in there, it can be very problematic. So the good news, we're still at 8 in Laguna Woods, which is amazing and much appreciated, obviously, for all the hard work that people are doing and staying at home and social distancing. Hospitalizations, unfortunately, 2 of the last 3 days have been the highest for Orange County since the COVID-19 reporting. So again, this is maybe a result of how we indicated we had higher numbers as positive a few weeks ago. Unfortunately, these people that have gotten sick, real sick from that, had to go to the hospital. Those numbers have gone up. So we're hoping, obviously, with all the treatments and everything, that we see a reduction in that hospitalization, because that's a concern that they always had, was we don't want the system to get overtaxed. And I think the system still has a lot of capacity in Orange County, so that's the good news. But it is kind of daunting when they see those numbers going up for hospitalizations and ICUs. So they'll keep watching that, and we'll keep giving you that kind of information. But again, back to the Laguna Woods, the village and the community as a whole, to stay at 8, for those numbers to be so low in its reporting, just congratulations to people, and want to keep you safe and healthy. And so we are still now going in our next phase with regards to what are we going to open up here and what kind of activities. And I'm pleased to announce that come next week, we're going to see pickleball and paddle tennis reopening. Again, on a conservative manner, or a reservation manner. And so we're finalizing those details today, get that out. And so we'll probably start taking reservations on Tuesday and Wednesday, and may be able to open up as early as Wednesday, but Wednesday or Thursday.
That's great. I mean, I know that pickleball folks are really excited. Do you happen to know, for the pickleball situation, would it be a singles?
Yes, it will be same setup as tennis. It will be singles for now. And then as we graduate into the program, we're going to be looking at doubles eventually. Okay,
great, great. Actually, I wanted to go back to some of the numbers that you were talking about. There was something you and I were talking about beforehand where you said there is more testing being done, but then you mentioned that there was a low number of positive cases. Can you expand on that?
Yeah, so what we saw was a spike in cases, the positive cases, for a while, and it got up into 200, 250 people that were testing positive. And what was concerning was what they were saying, it was the number of tests that were being done was fairly low. So the percentage of positives to testing was pretty high. What we've seen lately is that they're averaging about 1,300 to 1,400 tests on a daily basis. And when you only have 115 showing as positive cases, well, that's 10% or less. That is a very positive trend that everybody in Orange County is going to want to see. And the governors want to see. So that if we're talking about reopening the community again, showing a decrease in positive activity, showing a slowing down of the hospitalization, which hasn't happened yet, but I think it will follow. Those are critical to getting into the deep elements of phase 2 under the governor's plan, where you could actually go dine in a restaurant versus
Right.
just takeout. Some businesses could open for walk-in traffic.
Right.
That's what really people are looking forward to,
Right.
getting that activity. And for the village, that means we can move forward with more of our outside activities.
Yeah.
But we're still obviously being very conservative and want to control that environment, because it still comes back to the safety, health and safety of our residents here,
Exactly.
and making sure that we're not out in front of everybody getting more people sick.
Well, exactly. And one thing I did want to point out is that that number of 8 has been consecutive for almost 36 days.
Yeah,
so it's been
amazing.
very, very steady for a long time, and that's really important. So it's great that you guys are doing what you're doing. And then you mentioned the governor, and he's going to be looking at lots of different things. But what I think we're hopeful for is that he looks at individual cities as to where the numbers are rising. I mean, you can look on the website at ochealthinfo.com and click on the coronavirus COVID-19 stuff. And as you can, here we're showing you right now, is that by city, they tell you exactly how many cases there are. They don't necessarily tell you deaths and things like that.
Right.
But I'm assuming that where the highest number of cases are is possibly the higher number of deaths. Would that be a fair?
I think that's probably a
assumption?
fair statement, and I think that if you look at those numbers, if the residents do take a look at that, you also see that the higher population, higher density communities have a higher number of cases.
Right.
That's consistent with what's being seen all across the United States.
Right.
You know, the LAs, the New Yorks, the higher population, higher density communities. Because, again, that inability to distance was the big struggle at the beginning.
Right.
And so those kind of stats kind of confirm that. Anaheim, Santa Ana,
Yes.
Your bigger cities are where your higher cases are.
Exactly, exactly. And another thing is that we have had several conversations with hospitals and doctors and folks around our community. And, you know, you are also in contact with them. And
Right.
we recently spoke with the ER director, medical director of Saddleback Hospital, and they're ready to bring on other cases. They're not, you know, they're open for business, if you will.
Right.
They want to bring people in, and they don't want you to be afraid to come in if you're having a heart attack or if you're having a stroke. So are you hearing the same thing?
Yeah, especially in contact with our local hospitals,
Okay.
because I think the numbers in South Orange County are reflective of our less dense population. So the hospitals around here are doing pretty well from
Yeah.
our understanding. But you're right about the whole point is people probably got hesitant about going into the hospital, needing that care. And now that the hospitals, and we're trying to get that communication out too, don't be afraid to go use the services if you need them.
Right.
Don't stay at home because of that.
Right.
They're there for you. They have the setup for you. They can isolate it. And so it's great to have them back operating at full potential.
Well, exactly, and you don't want to put off things like you said. I mean, if you're having emergencies, the ambulance will come and get you. You know, dial 911 because they will come. They are prepared. They have all the PPEs and they're all prepared. So I don't think people need to worry as much as before, but honestly, don't neglect your health.
Exactly. And I think some optional surgeries and optional activities are now starting to come back if they're at a hospital.
Yes.
So that's something to look into if you had something planned. You know, re-engage with your doctor,
Right.
See if that can be rescheduled, because those opportunities are coming back along the line.
Yeah, great, great. Anything else?
Well, I just wanted to, again, mention about pickleball and paddle tennis. That's
Yep.
really nice to get that going. Tennis is got fully operational.
Good.
Golf is really going well, as we talked about, so that's really well. It's going to warm up, so I want to
Yes,
make
it
sure
is.
that after the Memorial Day weekend, Monday, Tuesday, Wednesday, we're going to see some really warm temperatures out there. So when you're engaging out there, make sure you have your water, make sure you take your time, because people haven't been out there as much, and now they're going back and re-engaging. When it's that warm and doing it, just be safe and
Right.
make sure you hydrate and do that. The other thing I wanted to mention is Monday is Memorial Day, and I just wanted to wish everybody in the community a great Memorial Day, and be safe out there. And please practice your social distance. We've had some calls with regards to the creek area where people love to walk and congregate and sit and enjoy that beautiful outdoor activity. but we need to make sure that people are doing it in a safe manner for the community, which is practice that social distancing.
I like what they did in, I think it was in New York or one of the areas.
The circles.
The circles that were in the park. That's a great idea. So when you're out there, just, imagine this big circle around you, and that will hopefully, keep people away.
It is a good idea, and I think more and more recreation parks departments throughout the country are looking at if they have like concerts in the park or anything like that they could do something like that and facilitate the distancing. And it makes it real easy to know where to sit, right?
So who's going to fight over the circles? It's like, that's my circle. All right, well, you have a great weekend and happy Memorial Day.
Thank you.
All right.
You too.
And we'll be right back, and we're going to discuss why we wear a mask out there. So stay tuned.